And we do this within the electronic medical record. So we can see when medications are started and stopped, and we can watch to see what happens with physical function, with people's physical function getting better when they start a new medication, pain going down, fatigue going down. And we can really show people, show the patient directly that these things are improving. What it's allowed us to do is to put numbers to symptoms and to follow those very precisely over time. And we're trying to understand how symptoms cluster together, how there may be different profiles of patients who have certain symptoms that group together, how those track with other measures of disease activity, how those track with things like flares of rheumatoid arthritis, and see if we can develop some predictive models where you may be able to say, oh, this patient has completed a questionnaire and there needs to be an alert built in that tells you their pain, fatigue, and physical function are all doing worse at this point. We need to flag that person for an intervention. I really envision a day where we have patients complete these patient-reported outcomes at home in between scheduled visits, or when patients are experiencing what they feel is a flare. And we can have things that are built in for decision analysis that will tell us this is a change from where that patient was. They need to come in for a visit so that we can make an assessment. And if everything is going well, then you may be able to put off that visit for another 3 months, but just by monitoring those symptoms over time. Because what we found is that the patient report and the physician report parallel very, very closely. And if anything, the patients are earlier at detecting change than the physicians can detect it when they measure and feel the joints.